We will continue our discussion on transplantation. We'll take up today a different branch in the transplantation immunology, which comes under regenerative medicine or tissue repair, because it is very well known that there is short supply of organs. Organs are not easily available. There are very few people who donate organs after the death of an individual due to accidental death. There are sentiments attached to it, and because of that, organs are not easily donated, and very few people are who are generous who donate the organs. But siblings, of course, they come forward to donate the organs, provided the organs are, in fact, bilateral. That is, two organs are present, or bone marrow can be easily transplanted, or the liver half part of the liver can be transplanted like that. But there are certain organs where you need a donor, and that cadaver donor may not be available, and there is shortage of organs. Because of the shortage of organs, many people die. Premature death they may face. For that reason, a branch that developed to develop the organ in vitro, that is, grow the organ in vitro and then transplant it to the individual. And that branch is called as tissue engineering, which comes under the transplantation only. And the organ that is grown will be with the help of stem cells, using the stem cells. And stem cells are coaxed to grow into organs that are desired organs, or at least differentiate to the level of the organ, and then transplant differentiated tissue in the place where the organ damage has taken place, and get the tissue repaired so that the tissue starts functioning. Okay. First, before we go to the details of stem cells and the derived tissues from the stem cells, we must recall back the germ layers, which you had done in cell and developmental biology. There are three germ layers in all vertebrates, and these three germ layers are ectoderm, mesoderm, and the endoderm. And they give rise to different organs. And for example, ectoderm gives rise to skin and nervous system, and your eyes. Eyes are also derived from the ectoderm. Then mesoderm layer that is present between the ectoderm and endoderm gives rise to muscles, bone, blood, connective tissue, cartilage, heart, kidney, adrenals, lungs, liver, gonads, like that. Many organs are produced from the mesoderm. And the endoderm gives rise to primarily the gastrointestinal tract and some exocrine and endocrine glands which are there in our body, including the pars distalis or the adenohypophysis of the pituitary. Adenohypophysis of the pituitary is derived from the endoderm. The nervous part in the pituitary is the pars nervosa, that is derived from the ectoderm. That comes from the nervous system, from the hypothalamus. And the two parts, the ectodermal part, that is pars nervosa, and the endodermal part, pars distalis or adenohypophysis, they fuse in the hypothalamic region to give rise to pituitary gland, which is an endocrine gland. Like that, thyroid, thymus, adrenal gland, pancreas, all these are derived from the GI tract, that is endoderm, and they perform the endocrine function. Okay. Now, each of these organs which are derived from the germ layers will have stem cells within themselves. After they grow into organs, after the differentiation process is over, there is a reserve of stem cells maintained, and the differentiated tissue will be there, and that differentiated tissue will perform the function of the organ, except the stem cell. And stem cell will depend on the tissue for its nourishment and retain the stem cell characteristic. And most important characteristic of the stem cell is when it is coaxed with the growth factors, it is supposed to divide. And when it divides, it will divide in such a way that one product of the division, one daughter cell, will retain the stem cell characteristic, another daughter cell will differentiate. Always, the stem cell doesn't get exhausted, means it will never run out of supply. One will retain the stem cell characteristic and the another will give rise to the differentiated organ. So therefore, the stem cell will be retained in the differentiated organs of all the individuals. And those stem cells of particular respective organs derived from respective germ layers will retain the markers of that particular organ, so that you can trace back the marker of the particular organ will be retained, and you can say that this stem cell is derived from this germ layer, and that characteristic will be there. Therefore, these stem cells, being capable of growing, multiplying in vitro, can be transplanted into a person, and the person can be treated with required growth factors through the intravenous route and expect that stem cell to grow the lost part of the organ, that is damaged part of the organ, and repair it. That is the assumption. Okay, except the bone marrow stem cells, other organ stem cells are not directly transplanted into an individual and expect the organ to develop. It is an hypothesis and it is an expectation. Probably in future it may come. The process may come where the individual will be given the stem cell and that is transplanted in the region where the damage is there, and he will be provided with the required growth hormones, and that will differentiate into the damaged part of the organ. That is the assumption. But at present, the technology is available to grow in vitro the part of the organ partially using the stem cells and transplant it back. Okay, transplant it back. So coming to the classification, the stem cells are classified based on their potentiality to develop into different organs into two different classes. There is one more class which I will talk about that when I come to that example. And from that class you get these two classes. That is, one is pluripotent stem cells, another is multipotent stem cells. Now, what is meant by pluripotency? Pluripotent stem cells are those stem cells derived from a particular organ or derived from a particular germ layer. Like, say, for example, they are of the ectodermal origin. The organ could be skin or the nervous system, and the stem cell is obtained from the skin, and you coax it to grow into the nervous system, as well as that stem cell obtained from the skin coaxed to grow into the organs of the mesodermal origin. Organs like, you can coax that stem cell to grow into muscles or into bone or bone marrow stem cells or connective tissue. Means one particular organ, germline organ stem cell, can give rise to two different organs of the two germ layers. That is pluripotency. But if the stem cell can grow into any of the three germ layers, it can give rise to the ectodermal derivatives, or it can give rise to the mesodermal derivatives, or it can give rise to endodermal derivatives. And such stem cells are called as multipotent stem cells, or you can also call them as totipotent stem cells. Okay, so totipotent stem cells, and those totipotent stem cells are present in the embryonic condition. when the early stage of development, when the egg is dividing into blastomeres, and you get, in the case of mammals, you get embryonic stem cells. And those embryonic stem cells that are produced in the blastocyst of the mammal, that embryonic stem cell has pluripotency. That means it has the potency to develop into different organs of different germ layers. But earlier than that stage, if you take, that is the embryo which has not yet formed into a blastocyst, it is still in the form of the division stage of the egg. Maybe 8-cell embryo or 16-cell embryo, it has been produced. At that stage, the cells will be totipotent. Totipotent is also equal to multipotent. Means these cells have not yet blocked or shut off certain genes. All the genes in these cells are active, and those genes can be taken into advantage and grow into a particular organ of any three germ layers, and that potentiality is called potent or totipotent. And among the embryonic stem cells, they partially retain multipotency as well as pluripotency after they become embryonic stem cells in the blastocyst. Okay? So therefore, they can give rise to the organs of other germ layers, and they can be coaxed to grow into organs of other germ layers. So there is also other classification. You can classify the stem cells into germline stem cells, or you can classify the stem cells into adult tissue stem cells. The germline stem cells are the ones which have multiple potency. Okay, the germline stem cells will have multiple potency, and they are generally totipotent. Generally, whereas the adult stem cells obtained from an organ, and that organ might have been derived from any one of these three germ layers, organ derived from any one of these three germ layers. And that particular adult stem cell has the tendency to grow easily into that particular germ layer organ. It will easily can be coaxed. Like if you had obtained the stem cells from the bone marrow stem cells, which are called as hematopoietic stem cells. Hematopoietic stem cells are mesodermal in origin, and they are available in the bone marrow. And they are not only capable of growing into different types of the lymph cells as well as immune cells. Okay, they are also capable of giving rise to other mesodermal organs, like you can coax them to grow into muscle or connective tissue or cartilage, heart muscle cells, kidney muscle cells, etc., etc. So, and that itself is called as pluripotency. That is easy potency to grow of that particular germline organ obtained from an adult tissue. That is stem cells of that adult tissue. But when you make that stem cell of a particular germline to grow into an organ of the other germline, then that pluripotency becomes multipotency. That's the only thin line of difference in multipotency and pluripotency. Pluripotency is formation of the organs of the same germline origin by using the stem cells of a particular organ of the germline to other organs of the same germline. That is pluripotency. But other germline organ, when it develops by coaxing, then it is called as multipotency. That's the only difference. And now let us move on to one adult important organ, that is our skin. Skin is the richest source of stem cells. And It consists of two parts, that is outermost epidermis and the inner dermis. Dermis is the muscular layer, is the largest layer, and the epidermis is the outermost layer, of which the most exterior layer is dead. And the most exterior layer is called as keratinized epidermal layer. And that keratinized epidermal layers contain keratinized epidermal cells without nucleus, and they are dead cells. And those dead, we lose them every day when we have our bath, or every day due to abrasion of the skin with our cloth. And those cells which are dying on the topmost, that is uppermost layer or outermost layer of the skin, are going to be replaced by the live cells from the bottom by the proliferation. Now, the cells that proliferate and give rise to the new cells in the epidermal area of the skin are the epidermal stem cells. They have just shown here with some red dots. Those epidermal stem cells are present in the basement layer of the epidermis, and the basement layer of the epidermis is called as stratum germinativum. Germinativum word itself indicates that it is capable of germinating, and germinating means nothing but growing. So stratum germinativum layer is present that separates the epidermis from the dermis, and that stratum germinativum layer is capable of dividing. And there are stem cells in that stratum germinativum layer, which are called as epidermal stem cells, give rise to the epidermis layer of the skin, which is being shed off on the daily basis. So these stem cells can be harvested by superficial incision on the skin of a person, by removing only the upper layer of the skin of the person. And from there, you can harvest these stem cells and grow them in culture. Okay, those are the epidermal stem cells. Then comes the second category, sebaceous gland stem cells. The sebaceous gland is the gland that is accompanying always the hair follicle duct. This is the duct of the hair follicle, and this is the epidermal hair which emerges from the hair papilla at the bottom in the dermal layer, and that socket which is there around the hair has got a projection or outgrowth which is like a finger-like projection, and that is called a sebaceous gland. And I had explained to you about this gland in innate immunity. It secretes oil, and that oil is used for grooming the hair. Plus, that oil contains many antibacterial substance which comes out and layers over the skin and protects your skin from hostile bacterial growth. Okay, that sebaceous gland, which is nothing but an outpouching of the epidermal layer only. This epidermal layer, that is stratum germinativum, has sunk inside, invaginated inside, and coming back. It is invagination. And invaginated stratum germinativum has been modified into a sebaceous gland, and that sebaceous gland at its base, where it is attached to the hair follicle duct, consists of stem cells there, and those stem cells are continuously growing, and whenever there is damage to the sheath of the hair follicle, then comes an area that is just adjacent to the sebaceous gland, which is called as the bulge region. And that bulge region contains the bulge stem cells. And those bulge stem cells have the potentiality, means they are pluripotent stem cells capable of giving rise to both the layers of the skin, that is epidermal as well as dermal layer of the skin, that is the potentiality of the bulge stem cells. Then at the base, the hair follicle has the dermal sheath, and then in the middle, the dermal papilla. And the dermal papilla is the one which provides the nourishment for the hair, and the hair has started growing from there and keeps pushing the keratin that is derived from the derm papilla into the hair so that the hair keeps growing out and it will be projecting out from that area. So the dermal papilla and the dermal sheath area contains a group of stem cells which are called as mesenchymal stem cells. And those mesenchymal stem cells also have the potentiality, they are pluripotent. They are pluripotent. Even though they are in the dermal area, they are mesenchymal, they are capable of giving rise to, in fact, both the germ layers, like both the layers of the skin, that is dermal as well as epidermal, when they are coaxed to grow. That means they become multipotent. So the mesenchymal stem cells in the dermal papilla and dermal sheath are also multipotent. Bulge cells which are present in the bulge region of the hair follicle are also multipotent, whereas the epidermal stem cells present in the epidermis are pluripotent, giving rise to different types of ectodermal derivatives. They will give rise to even nerve cells. They are capable of growing into astrocytes, glial cells, oligodendrons, and the neural cells, the epidermal stem cells. In addition to, they are capable of growing into skin epithelial cells. Now coming to the example of artificial skin. It is a technology now which is patented by Germany, and the German author who patented this technology also got the Nobel Prize for that. You can grow in vitro using the epidermal stem cells of the skin of a person, large sheets of epidermis, large sheets consisting of multi-layered epidermis can be grown, and that sheet that is grown in vitro can be transplanted onto another individual, and that transplant is accepted. But at the same time, remember, if the transplant is autologous in the sense I had used this word, auto transplantation, one can obtain the stem cells from the epidermis of a person who needs the skin transplant, okay, who doesn't want to damage his skin in other parts of the body. Remember, in the autologous transplantation, I had mentioned that one can harvest the skin of the person from the or from the thigh region or from the calf region and transplant it back to the region where it is required, where there is a damage that has taken place. It can be done. But nowadays, people prefer less painful approach, and it is involves lot of money, where the person who has a healthy skin in another region of the body can donate a small part of that skin to the tissue culture lab, and that person will harvest the stem cells from the skin of that person and start growing the skin epidermal cells using the epidermal stem cells. And once the skin epidermis is grown in large sheets, you can grow it, that is given back to the person and transplanted back into the area where the damage had taken place, which is plastic surgery, of course. At the same time, the skin stem cells, that is epidermal stem cells of other person's origin, also can be used, provided you have matched the MHC. And MHC has to be matched up to about 85% or 75%. Once that MHC has been matched, you can grow the epidermal stems of a donor, and then those epidermal sheets can be transplanted onto a person who requires it. But remember, here the rejection reaction will be there because of the MHC incompatibility that need to be taken care. One another advantage is, for the skin transplantation, minimum amount of immunosuppressive drugs are required. Why? Because the skin epidermal cells express very low MHC class 1. Class 1 MHC expression by the skin epidermal cells is much lower compared to other tissue. That is the reason skin graft is easier, okay, and less rejection reaction, which can be won over by the application or administration of immunosuppressive. Okay, then there is also possibility that one can easily transplant the hair of one person by uprooting the dermal papilla directly from that region and transplant into another person who requires the hair. Okay, from the dermal papilla region, the hair can be uprooted and transplanted into another person, and this hair papilla, that is the dermal papilla, will not be immunologically rejected even if you don't match the MHC. Why? Because it doesn't express MHC. Keep that in mind. This region of the skin, that is dermal papilla region of the skin, is called as immune privilege site or immune privilege organ. The immune privilege organ is the one which will not be rejected when transplanted. The reason being it does not express MHC. So therefore, dermal papilla transplantation of unmatched MHCs can be easily done into the individuals who require hair transplant. Okay, who require hair transplant. So the dermal papilla becomes immune privileged site. Another important immune privileged site I had already explained to you is the cornea of the eye. Cornea of the eye, from one person who is dead, whose cornea can be harvested, who has a good eyesight, his eyes were functioning normally but died of accident or died at a young age, his cornea can be easily harvested and transplanted to the another person who requires the cornea transplant, and it is not going to be rejected. It doesn't have MHC expression. Cornea does not have MHC expression. These are two very important immune privileged or the organs in an human being. Okay, then coming to the other regions of the skin, being a very important organ of the human body, many stem cells can be derived. You don't have to go to the depth of the individual, like harvesting the stem cells from the liver or from the intestine or from the heart. There are stem cells in the organs also. There are cardiac stem cells in the heart. There are stem cells in the liver, hepatic stem cells. There are stem cells in the intestine. Okay, you can harvest them, but they're deep within. So if one can get the stem cells from the skin of a person, it is easy and harvested and grow them and then give back the desired organ repaired, or the repair of the organ stem cells, whatever is required for the person, and autologous transplantation can be done, which will be not rejected, autologous, because it is obtained from the same individual. Now in the dermal area where the muscles are there in the skin, in this region on adjacent to the hair follicle, the muscle layer contains even hematopoietic stem cells. Just like the way the hematopoietic stem cells are there in the bone marrow, same type of hematopoietic stem cells are there in the dermal area of the skin. And those hematopoietic stem cells has equal potentiality like the bone marrow stem cells, and they can be grown into different mesodermal derivatives, mesodermal germ organs, because they are mesenchymal stem cells, just like the way hematopoietic stem cells of the bone marrow, and they can give rise to all different types of mesenchymal organs, and you can be transplanting them, and you can use them to and coax them to grow into particular organ in vitro and get the tissue repaired. Okay, so another important point is that the obtaining of the skin stem cells is less invasive compared to the other tissue organs, but doesn't mean that you're not supposed to do the invasive surgery and obtain the stem cells. One can obtain the stem cells from other organs also, but when the organ is there superficially, which is the donor of so many different types of stem cells and having multiple potency in some regions, like dermal papilla and the mesenchymal stem cells, so the dermal sheath and the bulge cells, plus pluripotency of other stem cells, it is easy to harvest it from the skin region. Therefore, skin becomes an important source of stem cells for regenerative medicine, as well as tissue repair, as well as for the transplantation. Okay. So now moving on to the embryonic stem cells, which I had just touched upon earlier to differentiate between the totipotency and pluripotency. Once the blastocyst is formed in the human being or in a mammal, that loses the totipotency, but it becomes pluripotent. And that example is shown here, pluripotency. Those embryonic stem cells, when you coax them with the required growth factors, you can coax them to grow into neural cells, which are supposed to be ectodermal in derivative, and cardiac muscle cells as well as blood cells, which are mesodermal derivatives. That means it is pluripotency. This is ectodermal, these two are mesodermal. Okay, that is pluripotency. Whereas when you use the early embryonic stem cells, that is at the embryonic condition of 8-cell stage and not yet fully formed into blastocyst at that time, not differentiated at all, and they are totipotent stem cells. So therefore, the eggs which are grown in vitro and fertilized in vitro, nowadays, you know, there is in vitro technology, in vitro fertilization technology available. Eggs can be harvested and those eggs can be coaxed to grow in vitro. And once they are coaxed to grow in vitro by fertilization, when they are in this stage, that is at the 8-cell stage or 16-cell stage, you can arrest the growth and stop them from transforming into blastocysts and freeze them in the liquid nitrogen so that you can use them as stem cells to grow into desired damaged tissue organs. Such type of stem cell banks have opened up now. In India, Reliance Life Science stem cell bank, and they have stem cell bank for different types of stem cells. One of the stem cells that they are keeping is the embryonic stem cells. And these embryonic stem cells, they are in fact growing them into blastocyst, as well as they are keeping them in the very early embryonic condition, in the frozen condition. And the donor has the free access to these cells free of cost and can use these cells in emergency if the person needs the transplantation of the organ after that is grown in vitro. Or the donor can give permission to donate these cells to somebody else who requires the organ to be developed in vitro. Okay, and that particular company, the Reliance Life Science, will charge for growing that tissue for the repair purpose and then give that organ, provided the MHC is matched. Once the tissue is differentiated, that will differentiate and express the MHC of that person who had donated, and that should match with the person who is going to receive it. So the stem cell banks, just like the way the blood banks are there, have started in developed countries, including India, which is a developing country. We have now stem cell bank in Mumbai. Okay. Then comes another important source of stem cell, that is the placenta. The placenta is an organ that grows in the uterus and remains in the uterus for 9 months during the development of the fetus. And the placenta is the most tolerant region of the body, in the sense it has suppressed the immune response at that region so that it is not rejected by the mother, because it is the close contact region of the fetus with the mother, and it will also express some antigens of the fetus there, because the placenta took its origin from the embryonic stem cell like this, the blastocyst, which implants in the uterine wall, uterine epithelium, grows the placenta there in the uterine epithelium. And the origin of placenta begins from the embryonic region, that is the blastocyst. Please remember that. And it is not formed by the mother. It is a foreign organ. Placenta is a foreign organ growing in the mother's uterus. And it has got all the embryonic antigens in it, but not rejected by the mother because it has got immunosuppressive ability. It doesn't allow any immune cells to act and reject that region. That is the wonder of placenta. So the placenta also contains stem cells, and those stem cells from the placenta can be harvested and also have multipotency. I tell multipotency because they can grow into organs, because it is, of course, it is mesodermal. Placenta is mesodermal. It will easily grow into mesodermal organs because it is mesenchymal. It will grow into the organs that are required as mesodermal organs like cardiac muscle cells or hematopoietic cells or pancreatic islet cells. At the same time, it can be coaxed to grow into neural cells and the hepatocytes. And the hepatocytes are endodermal. Please remember. So different organ tissues can be derived from the stem cell obtained from the placenta, which is multipotent. Okay, placenta itself becomes the source of stem cell. Generally, after the birth of the child, the placenta is born as afterbirth, and generally people throw it. Nowadays, stem cell banks have started harvesting the placenta and isolate the stem cells from the placenta and store these stem cells in the stem cell bank for the future use. And placenta becomes an important source of different types of hormones. And those hormones have clinical application. One can extract hormones from the placenta and use for clinical application for curing of the disease. Okay, that is as far as placenta as the source of stem cells is concerned. Then coming to the mesenchymal stem cells. Oh, one more important point I forgot to mention. The placenta grows the umbilical cord, this umbilical cord. And that umbilical cord will be in contact with the fetus. And that umbilical cord will have arteries and the veins. And there will be blood circulation, and the blood will be originating from the fetus, passing through this umbilical cord, coming to the placenta area, and fetching the required nutrition plus the oxygen from the placenta and going back. And there will be no mixing up of the fetal blood with the mother's blood. There is no direct contact of the fetal blood with the mother's blood, except that the nutrition from the mother's blood diffuses into placenta, carried by the blood through the umbilical cord into the fetus. So since this umbilical cord has close contact with the placenta, the umbilical cord also contains the stem cells, and those called as cord blood stem cells. The cord blood stem cells are restricted to umbilical cord, and these cord blood stem cells are mostly mesenchymal, and they are they are not only pluripotent, they are capable of growing into other organs, just like the way I mentioned the placental stem cells. Okay, the placental stem cells are restricted to placental tissue, but the cord blood stem cells are the ones which are mobile. They are moving in the blood vessel. They enter the fetus, they come back from the fetus, they keep traveling between the placenta and the fetus. And those cord blood stem cells are capable of growing into different organs of different germ layer origin, even including the nerve cells. They can be coaxed to grow into nerve cells. And they are capable of pluripotency as well as multipotency. So they are harvested and stored at present, and they are used for growing the organs that are required. Then comes lastly the mesenchymal stem cells. One best example for the mesenchymal stem cells is the bone marrow. Bone marrow is the source of mesenchymal stem cells, which is hematopoietic stem cells. And I said that those hematopoietic stem cells easily grow into that particular germ layer organs, which is shown by arrow here. But here the arrow is with question mark, indicating that whether they have the potency to grow, because being mesenchymal, to neurons or nerve cells, or whether they have the potency to grow into beta cells, which are endodermal. Beta cells are insulin secreting cells of the pancreas, endodermal, and nerve cells are ectodermal. Endodermal and ectodermal cells from the mesenchymal stem cells is doubtful. It has not been proved till date to grow into those cells. okay, or those tissues, but easily can be coaxed to grow into all different types of mesodermal cells. Therefore, they are pluripotent. So, bone marrow stem cells nowadays are used for the people who have problem with the bone marrow, in the sense they have genetic problem of insufficient production of WBCs or insufficient production of T cells or B cells, or they are suffering from some kind of leukemias. For them, the complete bone marrow can be replaced by the donor bone marrow, or one can obtain the stem cells of the donor and transplant it into the bone. Instead of transplanting the whole bone marrow, transplant the stem cells of the mesenchymal hematopoietic stem cells into the bone marrow of the recipient, and naturally the recipient will produce the growth factors, and if needed, assistance of growth factors can be given, and that person will start growing a healthy bone marrow in his bone marrow which was not functioning properly. Like that, the repair can be taken up and person can be relieved of that particular disease symptom. And such is the approach that is taken, provided the donor bone marrow stem cells, that is hematopoietic stem cells, have been matched with the MHC. Okay, but one important point that you must remember is stem cells do not express MHC. Stem cells do not express MHC. Any stem cells you take, whether it is ectodermal or mesodermal or endodermal stem cells or adult tissue stem cells, none of them express MHC. Only when they differentiate to form the organ and the organ is formed, the differentiated cells will express the MHC. That is the reason, even though the stem cells can be easily transplanted into a unmatched MHC person, later if you coax those stem cells to grow into a particular organ or repair that tissue, that part can get rejected once the differentiation takes place, because it will express the MHC of the donor. Therefore, it is always necessary, even transplanting the stem cells, to match the MHC and then transplant the stem cells for the required purpose. Whereas for the autologous transplantation of the stem cells, there is no need for matching the MHC and it is very, very safe. So here I finish the topic on transplantation and the related issue of regenerative medicine. Thank you very much.